What if the system that's supposed to help you is quietly failing you instead? Every year, thousands of veterans come forward with PTSD claims, expecting the VA to listen, understand, and rate them fairly. But what's actually happening in 2025 is a shift, one that sounds helpful on paper, but in reality is leaving many veterans underrated, overlooked, and stuck fighting for the benefits they've already earned. And the worst part? Most of them don't even realize it's happening. You probably heard the VA is making updates, replacing outdated language, restructuring how disabilities are rated, adding what they call modern clarity. But buried in those changes are flaws that punish the very people they're supposed to protect, especially those with invisible wounds like PTSD. This isn't just about red tape or paperwork. It's about a quiet reshuffling of how suffering is measured. Some veterans with severe symptoms are now being told they don't qualify. Others are being bumped down to lower ratings, not because they're getting better, but because they no longer fit a checklist. In this video, we're going to break down 5 critical ways veterans with PTSD are being underrated in 2025, and more importantly, what you can do about it before it's too late. Whether you're already in the system or about to file for the first time, this is information you can't afford to miss. Because the truth is, if you don't know how to fight for your rating, no one else will. One of the most damaging changes in 2025 has nothing to do with your symptoms. It's how the VA is redefining what functional impairment looks like. On the surface, it sounds reasonable. The VA claims it's moving away from outdated language and focusing more on how mental health conditions like PTSD impact daily functioning. But here's the problem. They've shifted the goalposts without telling you. Instead of focusing on a full scope of PTSD, flashbacks, insomnia, hypervigilance, emotional detachment, the system now emphasizes workplace functionality and observable behaviors. In other words, if you can show up to work a few days a week or hold a conversation without breaking down, your condition might be considered mild. That means many veterans are being told their symptoms don't meet the threshold, even if they're battling panic attacks, nightmares, or the kind of emotional shutdown that makes it impossible to connect with their family. You could be taking medication just to get out of bed. You could be avoiding crowds, struggling with trust, or jumping at every loud noise, and still be told that because you're functioning, you're fine. But here's the truth. Functioning doesn't mean healing. Surviving the day doesn't mean you're okay. And if the new system only rewards visible breakdowns, then the veterans who've learned to hide their pain the best, the ones who white-knuckle their way through life, are being punished for coping. This shift is subtle. It doesn't sound cruel, but it creates a system where strength becomes a liability. And what happens next only makes things worse. Another reason veterans are being underrated in 2025 is because of how the VA is now interpreting treatment compliance. Specifically, whether or not you're going to therapy or taking prescribed medication. Sounds simple, right? But here's the trap. If you're not in regular treatment, the VA may now assume your condition isn't severe. On the flip side, if you're in treatment and responding well, they might use as evidence that your PTSD is under control. Even if you're only functioning because of intense effort, high doses, or weekly therapy that barely holds you together. In both cases, you lose. If you stop treatment because it's not helping, or because it re-traumatizes you, or because the VA has 6-month wait lists, they treat your absence like you've given up or don't need help. If you stay in treatment and manage to keep things together just enough to survive, they decide you're stable. Either way, they assume you're not impaired enough to justify a higher rating. The nuance is gone. The personal story is lost. It becomes a yes or no checkbox. Are you in therapy? Are you taking meds? If so, things must be fine. But PTSD doesn't work like that. Some veterans avoid treatment because they're ashamed. Others because they've had bad experiences with VA therapists. And some are just too exhausted to go through the motions of explaining their trauma to yet another stranger with a clipboard. The system doesn't consider any of that. It reduces your reality to whether or not you're doing what you're supposed to do. And in 2025, that reduction is costing veterans the support they need, just because healing doesn't fit the VA's new mold. But that's not the only way they're distorting your experience. A third way veterans with PTSD are being underrated in 2025 is through something that sounds harmless, but is anything but cookie-cutter disability benefits questionnaires, or DBQs. These forms are supposed to standardize how PTSD is assessed. But in reality, they become a trap that oversimplifies complex trauma into checkboxes and vague language that barely captures what you're actually living through. Here's the issue. DBQs rely heavily on symptoms being labeled in preset categories: mild, moderate, severe, or total. But PTSD doesn't operate in neat stages. You can go from feeling okay in the morning to feeling like you're back in combat by nightfall. You can have moments of calm interrupted by intrusive memories, rage, or total emotional shutdown. That fluctuation, the unpredictable intensity of PTSD, is what makes it so hard to live with. But DBQs leave no room for that gray area. Worse, many VA examiners are rushed. Some never even make eye contact. They skim your answers, ask a few generic questions, and move on. The form doesn't require them to deeply explore your triggers, your isolation, or the guilt that keeps you from sleeping. Instead, they rely on a checklist that might mark you as stable just because you weren't visibly shaking during the appointment. Veterans are being boxed in by a form that was never designed to capture the complexity of combat trauma. And when your whole life is reduced to a few vague descriptions, your rating will reflect that, often much lower than it should be. This isn't just a flaw in the system. It's a misunderstanding of what PTSD actually looks like in the real world. And if you don't know how to navigate this process, how to fill in the blanks the DBQ leaves behind, your suffering may go completely unnoticed. But the real kicker, even when your symptoms are documented, it still might not be enough. Another major issue veterans are facing in 2025 is that the VA has become increasingly focused on observable behavior during evaluations instead of fully understanding what happens behind closed doors. In other words, if you show up to your exam clean, calm, and collected, even if it took everything you had just to get there, the examiner might decide you're functioning too well to be severely impaired. But PTSD isn't always loud. It's not always visible. In fact, some of the most debilitating symptoms, hypervigilance, avoidance, emotional numbness, can look like composure from the outside. Veterans are experts at masking. You've been trained to hold it together, to push through pain, to not let anyone see you struggle. And that training becomes your downfall during a VA exam. Let's say you've got panic attacks at night. You can't maintain relationships, and the thought of crowds sends your heart racing. But on the day of your compensation and pension exam, you sit quietly in the chair, answer questions clearly, and don't cry or shake. That 10-minute snapshot becomes the evidence the VA uses to say you're coping well. They're mistaking survival tactics for stability. It's even worse for those who've learned to intellectualize their trauma, talking about it like it happened to someone else, because that's the only way to avoid breaking down. The VA takes it as a sign of emotional regulation, not realizing it's a form of detachment that stems from deep psychological damage. So instead of rating your life as it actually is, they rate the version of you they see in that short window. The version that showed up, smiled politely, and said, "I'm managing." But what they didn't see was the anxiety attack you had in the parking lot, the nightmares you had the night before, or the way you avoid your own family because you can't control the irritability. The danger here is clear. If you present too well, the system will assume you are, and for many veterans, that disconnect is the difference between being recognized or being dismissed. But there's still another layer to this, one that goes even deeper than appearances. One of the most overlooked reasons veterans with PTSD are being underrated in 2025 is because the system punishes you for trying to survive. Sounds twisted, but hear this. If you're working, if you're in school, or if you appear to be functioning, the VA often assumes your symptoms aren't that serious. They use your effort against you. Let that sink in. The very things you've done to stay afloat, to provide for your family, to find a sense of normal, to keep your mind busy, are used as proof that your PTSD isn't severe enough to justify a higher rating. Take this example. A veteran forces himself to clock in every day even though he wakes up in a cold sweat, can't focus, and has to excuse himself multiple times just to breathe. He's not working because he's healthy. He's working because he has no choice. He's white-knuckling it through every shift, burning out fast, and falling apart the moment he gets home. But the VA sees employment and assumes functionality. Or a vet who signs up for community college as a way to stay distracted from intrusive thoughts. Maybe they only go a few days a week. Maybe they drop half their classes by mid-semester. Still, the VA points to that enrollment and says, "You must be doing okay." It's a system that praises resilience but penalizes anyone who dares to show it. Even therapy gets twisted. If you're attending regular sessions, following treatment and managing your meds, it's often interpreted as improvement, regardless of how painful or unstable your day-to-day life remains. But showing up for therapy doesn't mean your symptoms are gone. It just means you're trying. The truth is, surviving isn't the same as thriving. Holding it together doesn't mean you're not breaking down inside. But the system wasn't built to see that difference. It was built to measure functionality in the most superficial way possible. And if you're not visibly falling apart, they think you're fine. Looking back at everything we've uncovered, one thing becomes painfully clear. The system was never designed to see veterans as whole people. It sees numbers, check boxes, appearances, but not context, struggle, or sacrifice. If you've been downplaying your symptoms, masking your pain, or simply trying to push through and survive, there's a real chance you're being underrated, overlooked, and misjudged. Not because you've done anything wrong, but because the system was built to misunderstand you. And that's the part that cuts the deepest. Veterans with PTSD are often punished for doing exactly what they were trained to do: adapt, endure, and keep going. But your strength shouldn't be used against you. You shouldn't have to unravel completely, just be believed. If you've watched this far, it means you're not alone. You're asking questions, you're thinking critically, and most importantly, you're paying attention to what the VA doesn't want to say out loud. And that awareness, that's your power. So here's the next step. Don't stay silent. If you recognize yourself in any part of this video, it might be time to revisit your case. Get a second opinion. Document everything. Challenge assumptions. Because nobody else will fight for your truth if you don't bring it forward first. This isn't just about ratings. It's about dignity. About being seen for the full weight of what you carry every single day. And the more veterans who stand up and demand better, the harder it becomes for the system to ignore. If this video spoke to you, drop a comment below and tell us which part hit hardest. Your story might help someone else who's silently going through the same thing. And if you haven't already, make sure to like, subscribe, and turn on notifications. Because we're not done talking about the things most people are too afraid to say out loud. Until next time, keep pushing, keep speaking, and most of all, keep reclaiming what's rightfully yours.